27.1% of Victorians 18 and over have had 3 doses, so that number continues to grow. It's up from 25.9% yesterday. This weekend, the Booster Blitz is all about getting that number even higher, and everyone who's eligible for a booster, with the interval now changed to 3 months, going along, making an appointment or going to one of our walk-up sites, getting that 3rd dose and knowing that they've played their part both to protect themselves, the people they love, and to protect those that we all count on, our nurses, our ambos, our doctors, all those who work in our health system every single day. This really is a 3-dose project. To be properly protected, you need 3 doses. That's what the experts tell us. That's what I expect National Cabinet will reflect today. We'll have to wait and see how that runs. But the notion, I just want to be really clear with everybody, this is not 2 plus an optional extra. It's 3 doses in order to be protected against severe illness, as well as to minimise the likelihood of you getting the virus or giving the virus to someone else. Let's hope that our national framework reflects that practical scientific reality, the challenge we're living with today in the policy that we have set. 1,424,651 people 18 and over have had a 3rd dose, just to give you that in the raw numbers. 22,266 people were vaccinated at state sites yesterday, and just under 5,000 of those were 5 to 11-year-olds, thanks to mums and dads and to our younger Victorians who are going along and playing their part as well, getting a 1st dose, beginning their vaccination protection journey. There are more than 60,000 people aged 18 and over are booked for a 3rd dose appointment at the moment, but there remain 200,000 appointments that don't have anyone's name beside them. They are available. They're there for people to snap up. They apply over the next 30 days, and I'd encourage anybody who is more than 3 months past their 2nd dose, with that change we made yesterday, either having received a letter from the Commonwealth or because of those recent changes, just when they do the maths, it was more than 3 months ago. Please go and make an appointment. Please go and get a booster. Please go and get that 3rd dose. That'll keep you safe and see these numbers stabilise and indeed come down. Plus, of course, protect us against whatever variant is next, and we simply don't know what else is coming at us. The 3rd dose is critically important from that point of view as well. In terms of kids, more than 26,000 children are booked into appointments over the next 7 days, but there are more than 54,000 appointments available over the next 30 days. So just as for boosters, 3rd doses for adults, there are plenty of people booked, but there are plenty more spots open. So again, I just say to parents, I know there were some issues across the system very early on, as is often the case when you roll something out brand new. But there are plenty of appointments there now. It's much easier than it was. It's really important, and thank you again to all of those parents and young Victorians who've gone and begun that vaccination journey. Can I go now to hospitalisations? There's 1,206 Victorians in hospital with COVID. 122 people are in ICU, and 40 of those people are on a ventilator. Sadly, 15 people passed away with COVID, and we send our deepest sympathies and our best wishes to all of their families. This will be a very challenging time for them. In terms of case numbers, 10,273 people self-reported or registered their positive rapid antigen test result. They went to coronavirus.vic.gov.au/report and played their part, making sure that we've got the most complete picture of what's going on out in the community, but also taking pressure off our PCR testing centres, where there is limited laboratory capacity. It's not infinite, and this mix now, where it's about 50-50 in terms of positive results coming through home-based rapid antigen testing and PCR testing where that's appropriate, that is working much better than the very lengthy delays we saw when everybody was going and getting a PCR swab and a test through a laboratory some weeks ago. A further 11,693 people received a positive PCR result from 51,067 results, 51,607 tests processed, 51,067 I should say, tests processed. That gives us a total new case tally of 21,966 since yesterday, and a total active case tally of 246,894. So this is in the community, this is right across our state, right across every state in our nation other than WA, and it's incredibly important that we all play our part. So following those rules, there are not many rules, but they're very important that we follow them wherever we can, do our level best to follow those rules, that we isolate when we are waiting for a test result, if you've had to go and get a PCR, isolate if you're a household contact to someone who has tested positive. I know that there are many hundreds of thousands of families who've had a different summer than they had planned, spending some time away from other people. Many people are doing that right now, and I thank each and every one of them for the contribution that they're making. Your isolation, your sacrifice is not just important for you and your family, it's important, it's critical for every single family, and of course our health family, those nurses and doctors and AMBOs, taking just a little bit of pressure off an already stretched system. So thank you very, very much for everyone who's playing their part. You know that is not easy, but it's deeply appreciated. Now, in terms of announcements, I'm very pleased today to confirm that we have placed an order for a further 166 million rapid antigen tests. As you know, we had already ordered 44 million and had seen significant early deliveries arrive. 3 million I reported on last week. We've had another series of deliveries totalling 4.5 million this week. That makes all sorts of things possible, and we'll have more to say about the way these tests will be deployed and the environments in which they'll operate in coming days. Indeed, National Cabinet will be talking about some of these issues today. It's very important that we keep adding to that stockpile. They're going to be relevant, they're going to be particularly important in the weeks and months to come. And just like every other state in the country, I assume, and every other country around the world, we're out there in the international market and indeed some local market, pushing as hard as we can to get as many of these as we can, as quickly as we can. We had a couple of flights this week that did not land on the basis, didn't take off and didn't obviously arrive on the basis of the ash cloud. So you know, there are many challenges, many and varied challenges to continue to build to these stockpiles, but we're very confident that we'll be able to do so. And of course, there is that 10 million, 2.5 million which will come to Victoria out of the National Medical Stockpile as well. This is a very significant order that we've placed, among the largest I expect across the country. We've already distributed, by the end of this week, we will have already distributed more than 2.2 million rapid tests to our health workers, to staff in sensitive settings, as you'd expect, and also vulnerable communities. And that includes more than 50 community organisations that I spoke to you about a few days ago, them having a rapid test supply, using those proven and trusted networks, allowing them to reach out and provide the best service and care to their communities. That takes pressure off so many other systems and delivers much better outcomes, particularly for those who have underlying vulnerable circumstances. That vulnerability is best dealt with at a local, trusted, most personal way possible. We saw right through last year and the year before, multicultural communities, multi-faith communities, real community leaders stepping up, playing such important roles. And again, I thank them for their true and genuine leadership at the most difficult of times. We are delivering millions of these rapid antigen tests across the state. So many of our testing sites have RATs available for those who need a rapid antigen test. We are handing out literally hundreds of thousands of these. And Jerome may be able to speak in more detail about some of the trends in recent days, but it's, I'm very pleased to think that there are, on any given day, 40, 50, 60,000 people, perhaps more even, who are getting a rapid antigen test free from a testing hub, and that's about cutting off chains of transmission. When you combine that with people isolating, making that sacrifice, making that important contribution, that's how we limit or at least impact the number of cases that we have across the community. And what we know is a percentage of the total number of cases will finish up in hospital. So if we have less total cases, we finish up with less people putting pressure on our health system through no fault of their own. That's just the way this works. We don't have as many people in ICU as you might have expected if this was a Delta outbreak that had got away this much. That's the nature of this new variant. Not mild, but milder than Delta. The vaccines are still working as a protection against critical illness in the vast majority of cases. That's great news. But infectivity, the attack rate of this, the transmission rate of this virus, this new Omicron variant, is so high that the only thing we can do is get a third dose. We call it a booster. It's not really a booster. It's certainly not a bonus. It's critically important. 3 doses is what is needed. And then, of course, to isolate, play your part when you're called upon to do that. We're grateful. It's so important, and it is making a big difference. As we see some stability come to these numbers in recent weeks. Now, I just wanted to speak briefly in relation to announcements that the Acting Minister for Health has made today. We spoke about IVF services yesterday, and I made it very clear to you that no one's pleased to have to turn off or pause any services across our health system. But Co-Brown and the extraordinary and unique pressure that our system is under, and again I stress that's not because of money or the lack of machines we need or PPE or equipment, it's about people. And when you have literally 4,000, 5,000, 6,000 people who on any given day would be working in our health system but aren't because of COVID, that puts extraordinary pressure. So decisions were made based on advice. It's now appropriate to have another look in the context of things as they are unfolding, to kind of start with a worst case position and then try and reinstate whatever you can. I'm very pleased that the public health team, the Chief Health Officer, has reviewed his advice and the Minister's accepted that and been able to make a new decision under the new Act to reinstate IVF services. That'll take a couple of days. But those who are already in the system were still receiving, mid-cycle for instance, they were still receiving IVF services. It was about not having new patients come into that system. They'll be able to come into that system from early next week, and the orders will be effective immediately, and that is a very good outcome. I apologise for any distress, for any concern. It's never easy. It's never easy in such challenging times, and I just want everyone to know across the community, everyone's doing their very best just to keep people safe. That's what drives us. That's what everyone who's providing advice to the government is driven by, one thing and one thing only: to try and do everything they can to keep Victorians safe. But I do apologise for any sense of distress or pain out of this, but it's great to be able to have those services back on. And I thank the public health team for reviewing their advice, for changing their advice, and of course for the Acting Minister for Health for having made the decision he's made.